Hello, and welcome back to the Desi Buzz Talk Show. I'm your host, Dr. Shabana Parvez, and I have with me today Dr. Soujanya Pulluru, and she prefers to go by Chinni. Dr. Pulluru, she's a visionary leader. She's in sustainable healthcare. She's known for her dedication to advancing value-based care and innovative healthcare solutions. She's founded several initiatives aimed at improving global health. She is passionate about as an advocate for women's health and youth health. She's actively serves on many advisory boards on strategies promoting wellness and sustainability. She's got a commitment to humanizing healthcare. And currently, she is also serving as an incoming co-chair to the physician focused payment model TAC, Technical Advisory Committee. It is a Health and Human Services Subcommittee that advises all the Medicare services, and she has been reelected to her position. And again, she was also the Vice President and Chief Clinical Executive at Walmart. Um, she is all about value-based care. We'll talk about that with her and her amazing contributions to healthcare in the country. Welcome, Dr. Pulluru.
Thank you, Dr. Parvez. Very nice to meet you.
Nice to meet you. Um, so, Dr. Puller, as you have actually moved, you were studied in India, so you moved from India to the United States. One of the two questions I have is one, why did you pursue a career in medicine? And with that move from India to the US, how did any of those experiences shape your perspective on how healthcare is delivered?
So let me start with why I got into medicine. It's something that's just been a part of my life since I was a kid because my dad's a doctor, and I grew up, watching him deliver medicine, and especially in rural India when he used to go back to visit, as well as in the U.S. And so it's just something that I've always been a part of and fairly passionate about because I feel like it's such a calling in a service industry. The As far as studying in India and coming here, I grew up here, and so I had gone back
Mhm.
to study there. My parents had moved there at the time, and it when you see medicine practiced in India, it's a very different perspective on what you bring to medicine here. And so many physicians here that have
Mhm.
trained in India understand this. You don't necessarily you're trained in the art of clinical diagnosis. You're trained in the art of really understanding the depth of knowledge to a point that you can use that to sort of have intuition, have instinct. And so I do think that that's been awesome, but it's also been great for value-based care because if you think about it, Shabana, I hope you don't mind calling you that.
Mhm.
In India, prior to the last few years, all healthcare was cash pay. So
Mhm.
as a physician, you had to be very careful in how you spent the patient's money.
Mhm.
People couldn't necessarily afford for you to just order tests because you wanted to see what they were, or, it wasn't necessarily malpractice driven. And so it really teaches you to be very prudent in what you order. And that's the principle of value-based care.
Okay, that's amazing. So that actually gave you a lot of background and ability to bring that here. Um, and then, as you've been a family physician for more than 2 decades, I'd say, during this time, what have you seen as the biggest transformation in primary care?
The amount of, I would say the biggest one is ownership, right? When I started in this field, people owned their own practices, and
Hmm.
physicians had that level of sort of ownership and autonomy that came with it. As now, 75% of physicians are employed by large organizations. Some of that's necessary. Some of it is because of consolidation in the industry and the needs that, have happened. Now, I think that to our detriment, the thing that has changed the most is the administrative burden physicians face.
Hmm. Right.
We've always worked hard, right? Residency is hard. Our parents
Hmm.
worked hard. So it's not a matter of the amount of hours you put in or how hard you're willing to work. It's that the joy of medicine has changed because when you spend 15 minutes face to face with the patient, you're spending half an hour doing charts. And, that's not what we signed up for.
Right. Yeah, and that's really a good point. That's part of kind of one of the reasons I kind of left a little bit of the traditional path, to have my own autonomy again. But the industrialization, I guess, and the
Mhm.
corporatization of healthcare, how do you think actually that has affected people? Do you think that's better for? I mean, who is it better for? Is it better for the patients? Better for the physicians? Better for spending, or only for corporations?
So
Seems like.
I think there's give and take, right? It
Mhm.
has been a necessary change because of the level of regulation and the level of administrative work that comes in, even
Mhm.
just to bill for one patient.
Right.
And so, as an individual physician, it's almost like you have to have that, purchasing as a mass in order to be able to make things
Group
work
purchasing
and be
power. Yeah.
efficient. And so it has, it's come out of that necessity. I don't think it's a good thing for physicians in their psyche, or, there's been a demoralization or a lot of moral injury because they no
Mhm.
longer sort of own their practice, right? And so,
Right.
um, but I do think a lot of groups out there strive to give physicians autonomy in how they practice. And so whenever physicians tell me, well, I want my autonomy, I say, well, what do you want autonomy in? Because if you want autonomy to be able to train your front office versus, or do you want autonomy in the room and how you want to practice and how you want to sort of manage your schedule? And usually it's the
Mhm.
latter. And I think a
Mhm.
lot of physicians still have that. But um, it's the good part is that we've also, from a patient perspective, we have access to so much more data about patients, right? And
Mhm.
that's hopefully going to drive way better care. The bad part is we have access to a lot more data we have to wade through as a
That we have,
clinician,
yes.
and so
Yeah.
there's all of these things are they're sort of a mixed bag. Whatever's positive also has a negative bent. Whatever's negative also has a positive bent. So,
Right.
but overall, I think it's made it very difficult for physicians.
Mhm. Yeah. And in terms of value-based care, can you explain a little bit more about just how a little bit more about exactly what value-based care is, and a little bit of your experience in terms of leading, one of the largest independent multi-specialty physician groups, um, and really promoting this platform and this idea of value-based care. What kind of strategies did you use, or to I get sell physicians on it? Sell, how did you bring it all together between the physicians, the patient's benefit, and maybe the business aspect of it? How did you bring it together?
Yeah, well, that's probably a 2-day conversation, but I would say, so what value-based care is where you change. It's a payment mechanism, and it
Hmm.
basically changes the way that physicians and or the healthcare system gets paid. So
Hmm.
instead of, right now, I only would, if I'm in fee for service, I'm only getting paid when a patient comes in through my doors,
Hmm.
right? It
Right.
only and so when a patient comes in through my doors, I see them, I order tests, you do your best to take care of them. And when they leave, you, even though you want to be able to help patients, there's a lot of uncompensated time, the time that I'm on the phone with the patient, the time that I am reviewing their labs or their meds or whatnot.
Mhm.
That's all uncompensated in today's
There's
world,
lots
right?
of that. Yes.
And so you end up, in order to have a sustainable practice, you end up having to just see a lot of patients because that's the only way you get
Mhm.
reimbursed. In value-based care, especially in primary care, you get reimbursed for keeping the patient healthy. So imagine if that same diabetic patient came in and I'm getting a certain amount per month in order to take care of that patient and just keep them healthy. So now I can actually spend the time to look at their chart, spend the time to call them, make sure that they did pick up their medicine, or hire someone to do that, because now I
Mhm.
can afford to hire someone to do that, right? And so
Right.
it ultimately leads to better outcomes,
Mhm.
and I do believe it leads to a lot more satisfaction from the physician perspective because you're not sort of tied to this sort of hamster wheel. You can actually invest resources in taking care of a patient differently.
Mhm. So you found that both physicians and patients have been satisfied with this kind of newer system, usually.
I think it's the transformation to it is difficult for physicians because
Mm-hmm.
it's a difficult way of thinking.
Mm-hmm.
And a lot of times it's made in environments where they have to do both, right? And so that becomes hard. And
Mm-hmm.
you have to, it becomes a delicate balance. They don't have the right data, or sometimes, it's we're saying, well, we'll pay you to take care of a patient holistically, but you get no other resources. Like, we're not going to hire you a nurse, or we're not going to hire you. And so then that's a difficult thing, because you're not really equipping physicians to do the things they're best at, and taking some of the other things to do the best thing. Community health worker is really good at figuring out community resources and how to help a
Right.
patient get
Yeah.
what they need. I'm not.
Mhm.
That's not what I know, right?
Yeah.
And so
Unfortunately,
I
that has fallen a lot on primary care physicians as trying to
yeah,
do all
and
the
so I think that
services.
when it's done correctly, physicians,
Mhm.
when it's done correctly and physicians get to the other side of it, they are actually happier, and they're compensated better, and they're usually there's just more job satisfaction, and they have smaller panels.
Mhm.
Um, and patients tend to be happier because now, patients love the fact that, like, wow, my office actually noticed that I didn't pick up my meds, or that I didn't, they care enough about me. And you start to see these testimonials from patients. So I do think it's a much better system, which is why I've
Mm.
invested most of my professional career in it.
Right. Okay. So what you also were involved in private equity, acquisitions, and when you did all these, was it easier to do this transitioning and merging into value-based care with private equity versus like a governmental, managed service system? Do you
So,
have challenges with that?
people demonize private equity.
Hmm. Yeah.
And I don't necessarily believe that it's all merited to be
Right.
demonized, right? And so
Hmm.
I think it has to do with how much operational intrusion they have. I
Hmm.
think, the one thing that private equity does is force you to be very precise in how you deploy resources, and be
Right.
very careful in how you manage money. Those are all things we should be doing anyway, right? Because we have to
Hmm.
earn the right to be sustainable. Having ultimately a practice is a business, and we are all business owners when we own our
Hmm.
practice. And
Hmm.
it's not charity; it is a
Hmm.
business. And
Right.
if we want it to be charity, then you do that separately and you define it as charity. But
Hmm.
and so, private equity almost forces you to acknowledge that and say, hey, like, we do have to deploy resources in a way that we're going to be sustainable. The
Hmm.
second thing is that they bring a lot of resources to the table. So when our private equity group bought us at DuPage, now Duly, they brought in people who knew what to do with data. They brought in people who were national experts in certain things that, we wouldn't have that kind of ability. And so they really upped our game that way. I would
Hmm.
say the difficult part is the same thing. If if there is operational intrusion, and that's something that you do have to sort of, I guess, negotiate. If there is
Hmm.
operational intrusion, sometimes decisions get made that without an understanding of how medicine is practiced.
Hmm.
And
Yes.
or there's a change of leadership, because they'll bring in oftentimes people just with amazing resumes and superstars, whatnot, but they don't understand the ground, and they don't
Hmm.
understand the magic that made the group successful in the first place, right? And so I
Hmm.
think, you have to um I don't feel that private equity is a negative thing. I just think you have to manage it a certain way, and it can actually help a group become sustainable, and grow and thrive versus not. But it can
Hmm.
also make it very difficult for the physician. And that's all something that just needs to be negotiated up front and managed.
Hmm. That's true. Good point. Tell us a little bit about your experience at Walmart when you were chief clinical executive at the Walmart Health and Wellness. So you were responsible for coordinating maybe primary care and dental care in many states. And what, from that experience, did you come up? Were there any innovations, any lessons that
Yeah.
impactful for the future of healthcare?
Well, a couple of things. First of all, I loved working for Walmart. It's a phenomenal company, and it's a great company in the way that it's run. It's a very phenomenal leadership. Um, I learned a lot of lessons around how customer focused they are, how
Mm,
patient focused they forced us to be, right? And they're very consumer centric. They were very patient centric, and we actually taught very specific language to our receptionists and our staff, that we got from best practices around the country, including companies like Disney.
mhm,
And we actually everything we did was to be very consumer focused, and our NPS was 80, which is unheard of in healthcare,
mhm,
and our net promoter score. And so
mhm,
that, if I ever go into setting up shop ever again, I know that lesson will be really huge to me, is to just have that
mhm,
singular focus on how the patient is feeling and what the customer wants,
mhm,
and listening to them. The other thing that Walmart is very good at is scaling. We built clinics
mhm.
in 6 weeks, 2 months. From permitting to go live. And, I
That's
learned
incredible. 6 weeks. That's
or two
wow.
months even sometimes.
Mhm.
Yeah. Even our testing centers, I mean, we went from one testing center to over 600 in a few months during COVID.
Uh-huh.
And the way that they are able to operate and scale, and just do it with such exactness and precision is because everything's documented. Nothing is dependent on one person's mind. Everything is replicable, and it's standardized in a lot of ways. And I
Mhm.
think that healthcare can really learn from that.
Mhm. Okay, that's actually good point. Having standardized protocols and then
Yeah.
being replicable makes you more scalable and
And they're willing to
repeatable.
make mistakes, right? They're
Mhm.
willing to test things and pilot things and make mistakes and fail
Mhm.
fast. They're also willing, one of my favorite things about Walmart used to be
Mhm.
that after one of our clinic launches, we had our day one launch and our day two
Mhm.
launch. We had probably these correction of errors, they're called meetings,
Mhm.
COEs. And it was at 5, 6 o'clock in the evening because people in the field needed to attend. And there were like 100 people in this meeting. And didn't matter who you were. It didn't matter where on the hierarchy you were. The expectation is that everyone spoke up and everyone talked about what went wrong.
Oh, that's really good. Good lessons there for larger corporations to give everybody a voice and hear from all levels, I guess, what can go better and what was not working for
Yeah.
them in their level or
Yeah.
the ground where they were at. What about you United Health Group and Optum? You did that change working with them? How did it change Walmart's focus more on senior health? My parents actually have United Health and
Yeah, that's
Optum.
awesome.
So they're value-based care, and with senior health, did
Yeah.
that improve
Well,
their focus?
it slightly shifted our business model to be more focused on senior care, and we sort of hired and developed clinics that were focused on that. And enjoyed working with both United and Optum. They brought a lot to the table. And unfortunately, the program itself didn't get to live more than a couple years and mature because of Walmart sort of pulling back on that. But other than that, it was when it was working, it was great. And Walmart has a high percentage of seniors that walk into
Hmm.
their stores, and so
Right.
it was a very natural partnership.
Hmm. Yeah. Good. Now going on to a slightly different, we're shifting gears a little bit in terms of some of your kind of side maybe work. Uh, Tell us a little bit about My Precious Genes. Is what do you do in terms of genomics? What is your opinion
Yeah.
on
So,
gene sequencing, genomics, and testing?
well, I think genetic testing and genomics is going to drive healthcare in the future.
Mm-hmm.
I think 10 years from now, we're going to all look very different in how we practice medicine, right?
Mm-hmm.
And so, the reason I co-founded this company, My Precious Genes, is because right now, cancer therapy, about over 90% of cancer therapy is driven by genetic testing, the
Mm-hmm.
regimens,
Mm-hmm.
prenatal and infertility. But if you
Mm-hmm.
think about cardiology, hypertrophic cardiomyopathy, or some of these other syndromes, there's genetic basis. And so there's a vast amount of under testing. There's also areas where, like pancreatic cancer genes, right? One in
Mm-hmm.
10, yes, this last Thursday was Pancreatic Cancer Day, and I believe
Mm-hmm.
it's 1 in 10 carry the gene. And so it's it becomes very important to sort of understand your genetics and understand what risk profile you have.
Mm-hmm.
And if you think about the value-based care world, and you're a provider, imagine if you have patient A who has high blood pressure but has no other risk. If you have patient B who has high blood pressure, but their genetic sequencing tells you that they're 4x or 8x risk for heart failure, wouldn't you treat patient B's blood pressures? You'd hold them in tighter control. You would
Mm-hmm.
probably echo them sooner. You
Mm-hmm.
would just treat it differently, right? And so,
Mm-hmm.
and that's good because you get to better outcomes. And so I think that precision medicine, genome sequencing, and genetic counseling, which is what we do.
Mm-hmm.
We don't do the testing component, but we will recommend the best test.
Mm-hmm.
We is really the way of the future.
Mm. What do you say to those who are scared about, one, the privacy issues with having whoever has access to their genome, and the two, the scare, what they might be worried about, well, geez, if my insurance or somebody has my genetic risk, then my insurance is going to go up, or, their premiums will go up.
Yeah,
Where do
yeah.
you see that happening?
Well, from a privacy issue, so much of our lives is already out there, right?
Mhm.
And I mean, there's 23andMe has 130 million Americans genome sequenced. So,
Mhm.
it's out there. And so I think that the vast majority of, this comes under HIPAA, and it comes under the protections of biomaterial. You can't transport it internationally right now.
Mhm.
And so it does, there are protections in place.
Mhm.
As far as, your employer having a view or your insurance company having a view, it's the same as anything else in your history. And luckily, pre-existing conditions don't count right now with the ACA. But I do think that there are going to be some regulatory hurdles that we're going to have to look at. Like there's definitely going to be, as this becomes more and more pervasive. Right now, it's actually disease specific. We already know you
Right.
have this disease and we're just doing
Mhm.
testing, or we know your family has this disease and we're doing testing.
Mhm.
Um, but I think that as time goes on, we will have to look at some of the ethics around it and some of the sort of regulatory guardrails that go around it.
Where do you think that, what level or who's going to maybe take the lead on that kind of, when you say we have to look at that, is that going to be at the governmental level, of which level of regulation, or, federal, state,
Well,
or what kind of agency might be involved in that?
I think it starts with first, it starts with the testing company, right, to protect the data.
Hmm.
Second, it is the ordering provider and the healthcare organization that you trust. And
Right, with the HIPAA
yeah,
rules
I
for
mean,
that.
yeah, they're already protecting some of your data.
Hmm. Hmm.
Third, yes, it will be, regulatory agencies such as the FDA or government, whatnot, because right now there are rules around if you see a doctor, for example, there's certain things your doctor can share with your employer, and there's certain things they can't. And there's rules around it. And so, those rules should cover this testing as well. But as time goes on and things become more and more convoluted as far as wellness, then, we'll have to see. But right now, if you go to even an employer health clinic, your employer doesn't have access to your blood pressure readings, for example,
Hmm. Hmm.
and they can't make
Right,
decisions based on your blood pressure readings.
right. Yeah, that's good. That's true. Um, what do you think in terms of um, technology and healthcare? I mean, have you what are the gaps you think that technology can help with healthcare, and what other gaps do you see currently in our healthcare system? You know, because I know you were an advisor and board member for many other healthcare organizations and private companies, but how do you think technology can bridge the gap in our healthcare system?
I think viewing technology not as a replacement for doctors or providers,
Mm,
but viewing technology as a tool in order to make us more precise, more efficient, and better able to reach the patient and engage them is where technology plays a role.
mhm,
For example, if you can surface not give a physician 100 data points before they walk in a room, but if you
mhm,
can surface the data points that really sort of matter in that moment, maybe three, maybe five, then the physician's focus is different, right?
mhm,
As you start to expand the care team and you have nurse practitioners and PAs, RNs, community health workers, if you can start to really use technology to divide the labor and say what can go to who, then you can expand the scope of what a physician can handle. And
mhm,
so you can probably sort of, we know we have a physician shortage in this country. We know it's getting worse. And so we know we're going to have to have other allied professionals as a part of the care team in order to get the Americans the care they need. How you leverage those, I think technology can play a huge part in that. And then if you look now, about 24 cents on every dollar in healthcare goes to pay physicians. And I'm talking everybody, primary specialty,
mhm,
everybody, or the care provider, essentially,
mhm,
the billing person. Um, about 60 cents goes to administrative cost. And so if you think about the stuff that technology can cut out, right?
mhm,
You don't need coding review experts. You don't need people to touch your bill. You don't need so many. So I think that there's just so much that can be cut out of that middle.
mhm,
And that
mhm.
just, one, it reduces the cost of care. And two, it leaves more money to actually pay physicians
Right.
and actually pay, to
Mhm.
have a community health worker, a pharmacist, an RN as part of your care team.
Right. So then that leads to my question on your role as you're the co-chair of the technical advisory committee, the physician focus, the payment
Mhm.
model. And so this actually puts you in the forefront. And so you understand very well the payment system, like you talked about, and what kind of what do you think is what do you see as the future? What kind of you see the trends that you talked about? They're still very top heavy in terms of administrative and
Yeah.
bureaucratic. So are you in your role? Do you plan to take an active part in like reducing that gap and diminishing the administrative role or
I hope
administrative
so.
cost? Uh,
I hope so. I mean, we're an advisory committee that,
mhm,
help advises the secretary as well as works with CMMI and CMS. So we
mhm,
hope to be able to bring together thought leadership and surface, concerns and barriers from people who are in the trenches, right? And so we actually do solicit and bring people to the table as part of panels that are out there doing the real work. They're leading,
mhm,
large groups, small groups. They're out there in the trenches and they understand how policy affects people when it gets translated down. You might
mhm,
have an intention when you make policy. That intention doesn't always play out because of
mhm.
the way it's written. And I
Right.
think that, one of the things that the committee does really well is to bring all of that, almost bring the trenches along with academics to Washington to say,
Mhm,
hey, let's take a look at what we've already done. And as well intentioned as these things are, there's some consequences that happen, but
mhm,
maybe we can design better by listening to these folks, right? And so I
mhm.
think I do hope to play a part in, I'm the current co-chair actually, and I do hope to play the play a part in helping advise that or helping design that.
Okay. Well, I wish you the best of luck in that. Definitely, we need that. Um, and with all the work that you've been doing, actually, how in terms of you're a mom of three, is that right? How
Yeah.
do you balance out your your professional commitments, your personal life? How do you keep yourself in the best of health?
Yeah. Um, I'm a fan of Indra Nuri, and she said, you don't really balance, right? You kind of, you're out of balance, and it's a matter
Mhm.
of figuring out where you compromise. And so I used to always tell people that, my kids' birthdays was a cake from Costco. I didn't have like custom made cakes and, their names on the brownies or the bottles. I mean, that's
Mhm.
my kids knew that. They just, that was going to be what they're, I tried my best, but there's certain things, and you have to be okay with that. You have to be okay that there's compromises that you make, your family makes, your husband makes, because you are working, or you're dedicating the time to this. The other
Mhm.
side of it is, they benefit from it, right? And so
Right.
I think the important thing is to just try to be there as much as you can for your children. Be very clear on what you feel is most important, that you're there. I used to tell my kids that I'm not going to be at every practice.
Mhm.
But I will come to these games, or I will be there at these important things. And I would tell them that if there's something very important to you, let me know so I can put it on my schedule and make sure I'm there. You're just,
Mhm.
I didn't have that luxury. It's sometimes as
Mhm.
a woman, you make those compromises.
Yeah. What is would you say your secret sauce to your success so far? What has kept driven you, what motivated you? What's your
I think it's the constant ability to learn and grow. What I do now is nothing that I was formally trained to do.
right?
And every few years, I would say, there's a whole turnaround in what I know. And so, constantly putting yourself in a position to learn and rethink and retest your assumptions, because
Mhm.
I always tell people that I have the right to get smarter, because it is, you constantly have to rethink yourself. And
Yeah.
that's probably the thing that's helped me the most, because I've learned from everybody. I learned from operational people at Walmart, my executive assistant on how to like do Excel. I've learned from everybody around me.
Yeah, that's great advice to just continually be in the mode of willingness to learn because that nobody knows it all. So you continue to learn, and even like you say, same thing in my practice. I've continued to change.
Yep.
Taken on so many, um, I guess, yeah, just so many transitions, and you continue to learn, add new things, and
Yeah.
as knowledge and healthcare and medicine changes, we have to change along with it. Yeah. So, what in terms of there is rapid transformation going on in healthcare now? So, what do you have as your vision for the future of value-based care? I mean, just healthcare in the next, I guess, the coming decade, perhaps.
Well, I hope that everybody is in some sort of value delivery system, to the benefit of both the physician and the payer, right? I hope that
Mhm.
it's not so painful for physicians either. And I do hope that with the advent of technology, we're able to better allocate resources to patients who need them the most, in a
Mhm.
way that allows for patients to stay engaged, right? It's like we spend all this money, we keep trying hard, we try harder, but the country's just getting unhealthier. And so
Right.
clearly there's a disconnect. And so I think
Mhm.
it's, sort of leveraging the forces of what the rest of the world has found out in population health, as well as other industries have found out in technology, to
Mhm.
bring it to healthcare and not be afraid to change. We have to be bold because people are just getting unhealthy.
Yeah. So, as they're emerging healthcare leaders, what advice would you give them then to make this impact? As you mentioned, we're spending more but still getting unhealthier. So, how do we
Yeah.
bring those together? How do we improve healthcare equity or patient outcomes? Um,
I think there's two pieces of advice I would give. The first is, remember that your role is to focus on the patient.
mhm,
I used to always say patient first, physician or provider second. But or they're the same in some situations. But if you're not focusing on why you're there in the first place, you've already lost. And so
mhm,
that's the first thing. The second thing is to not be afraid to rethink old norms. If you do things just because you always did them that way, why?
Right.
Like we used to, I mean, we made patients come in during banker hours and wait a half an hour to an hour to sometimes 2 hours for us. And then we didn't see them when they were 10 minutes late, right? How does that make any sense? So I
Hmm.
would say that be willing to, as a healthcare leader, be willing to rethink and just pressure test why you would have to do something a certain way. Just because someone did it that way in the past doesn't mean it's the right way to do it.
Yeah. So it's part of growing and adapting. Just keep asking why, and
Yeah.
to, so you can make something better. What about your other fun things that you do? You said music, historical
Yeah,
fiction.
I
How
do.
do you have creative outlets? Do you play an instrument, or yeah, how do you
Gosh, no.
just get
No,
stressed
I'm
out?
not that
You
artistic.
just go to a rock concert, or
Yeah, I'm a big live music fan. So I love
Mhm.
going to, across probably about 5 decades of genre. I enjoy live music. So I will constantly seek that out. I love to ski. So I do
Mhm.
ski at
That's
least
good.
a few times a year.
Living in Florida,
Yeah, I know. We have
you
to
love to
travel.
ski. It's awesome.
I do, and I love just the sun and sunshine and beaches and whatnot. So I love to read. I don't get to read as much historical fiction or other things because I'm usually reading medical stuff or policy stuff these days. I probably need to do
Right.
more of that. But it's amazing to read historical fiction or historical or even biographies of people
Hmm.
in the past and learn how they made decisions and learn what tested them and you learn a lot from that.
Hmm. Yeah, that's true. Okay, great. And would you have any advice to young generations? What would you say to to inspire um, other young South Asians or other young people who want to maybe follow and do something similar to what you're doing? I mean, there's a lot of South Asians that go into medicine, right?
They
But
do. There's nothing wrong
but
with that. I love
there's
it.
nothing wrong with that. But then a lot of them don't uh, really make it into like leadership positions like you have. I mean, in the kind of, the leadership
Yeah.
structure that you're in. So how, if they wanted to, or if they're scared of it, like what would you say to them about, any kind of advice for young people watching this?
I would say be bold, take risks because, we're privileged, right? I grew
Hmm.
up with a dad who's a physician and um, we're privileged to be able to have that choice to live where we do and to be able to get an education, particularly if
Hmm.
you're a woman. And so, to be bold and take chances. And, I just told my son this morning that, the world should be a better place because you lived.
Right. So you want to do whatever you can do to make the world a little bit better.
Yeah.
It's, yeah. That's good advice. Great. Any and then how can people learn more about you or connect with you?
LinkedIn is always great. It has
Mhm.
my contact information. Reach out to me in that forum.
Mhm.
I'm always open to talking to people or being, meeting people. I'm an extrovert by nature, so it gives me energy to meet people.
Yeah, awesome, awesome. So, are you hopeful about the future of healthcare? I mean, do you?
I am. I
Yeah.
am. I'm very optimistic because I do
Mhm.
think that the amount of just brilliant founders that I've met who are coming up with solutions, and entrepreneurs who are coming up with solutions that,
Mhm.
while they're not large scale, they don't have to be, right? It's a small
Right.
solution that ultimately gets adopted by a little larger and a little larger group
Right.
that is actually the big change.
Mhm.
And so I'm very optimistic. It's just between genetics and AI and the amount of sort of just brilliant, energetic people that I've seen committed to improving whatever sector of healthcare they want to, I do think that eventually all of that's going to come together.
Yeah, so this is where you were talking about like, the intersection of clinical medicine, business strategy, and innovating with technology. You see that as we encourage more of that, that we will actually
Absolutely.
improve
I
healthcare.
think that I think healthcare is ripe for innovation, and particularly from the outside.
Yeah, and I
But it
think
should,
yeah, from
but
the
it
outside.
should, yeah, absolutely. But I do think it should partner with a clinical lens because going back to my original premise, right? You have to keep the patient in mind.
Right. So the focus on the patient, and what I think also personally too is really focus on wellness, preventative care, and not just
Mhm.
illness and sick care. I think we really need to transition and keep
Yeah,
that.
focus on how people live their lives.
Yes, lifestyle. No, good. I'm hopeful that we'll see more change in that way, and that you'll be at the forefront of that. It was so wonderful. Talking to you, Chinni, and I wish you all the best. I'm excited. Uh,
Absolutely. Thanks, Shabana. Same here.